Welcome back to our final segment of Chamber Exchange, the TV show. I want to thank the sponsors that make it happen, Bank Hometown and Saint Vincent Hospital. And this is timely because in our final segment, we have Dr. Adam Darnobid, who is the medical director at Saint Vincent Hospital in the emergency department. Doctor, welcome.
Great. Thank you for having me today.
Yeah, well, I look forward to the conversation, but maybe, before we start, I think it's important for, people think of hospitals and logically, they think first and foremost healthcare and professionals and being there in a time of need for a family member or oneself. But as a chamber, we also look at it from an economic development point of view. And St. Vincent Hospital is the third largest taxpayer in the city of Worcester. And then secondly, between direct and indirect employment, well over 2,000 people. So you're in a hive of activity.
So when I have the pleasure of taking people around the hospital and showing them Worcester, who are from out of town frequently, and showing them our facility, we are in the middle of downtown Worcester, and I think St. Vincent's Hospital is exactly that. It is part of the pulse of the city. It's right behind City Hall. It's right by the Palladium. It's right by Mechanics. It's there in the middle of everything. It's bringing people to our community, and it's not just the hospital where you go where you're sick. You go there for your preventative care. You see your primary care there. Right. You can see your pediatrician there. You can have surgery there. It's so much more, and it's so much more to our community. I think you got that right.
A whole bunch of people go for their morning walks and then coffee.
Oh, the atrium is beautiful. Yeah. The Dunkin' Donuts is outstanding there, and the food is great in our hospital for sure.
Yes, yeah. The Stimulus family do a great job of running the food there. Well, Worcester, as we know, the major city, second largest city in New England. Not just Worcester residents, but people who are in need in terms of medical issues and challenges come. Oftentimes the emergency department's the first place. Maybe you could kind of just talk a bit about that work. And yeah. Sure.
Our ER in the middle of town, we are staffed. We are open 24/7 for your emergencies, for sure. Somebody is there willing, ready, and ready to take care of you. If you have something that you're worried about or something that's wrong, that's the threshold I use to tell you to come to see us in the hospital. If you're worried about it and you think it's serious, by all means, come see us. You can or cannot call the ambulance. I'm going to, let the people use their discretion or their judgment. But if you're having chest pain or shortness of breath, if something's moving or not moving that's not supposed to, by all means, come see us sooner. We are waiting to take care of you, and we want to see you for sure. Our nurses, our technicians, our doctors, our physician assistants, and our nurse practitioners are not just calm, cool, and professional, but empathetic. And we are there 24/7, 365 to handle your emergencies and to take care of you and hopefully get you pointed in the right direction after that. So it's not just about your care at St. Vincent's for that moment. I want to send you along to our cardiologist, to our primary cares, to our specialists, help get connected to our community of care so you can get the right care that you need for the rest of your life. And I understand that's hard in Massachusetts at this time. People are struggling to find primary cares, to find specialists. You get the medicines you need, and we're there to help you with that.
Right. So emergency room, right to the hospital, but then there's also, we've seen the growth of kind of urgent care facilities. How do people distinguish?
That's hard, right?
Yeah.
And I'm going to go back to what I mentioned earlier. If you're worried, if you're anxious, if something is serious going on, please don't wait.
Right.
We learned that in the pandemic. People had health emergencies, and they said, you know what, it's bad out there. I'm not going to go out of my house. And they had medical emergencies that should have been treated sooner. By all means, if you're worried, if you're anxious, please come visit us in the emergency room as fast as it's safe or as expedient as safe. For little stuff, for like bug bites that are just itching, that's an inconvenience, by all means, go to urgent care. But if it's a bee sting, it's swelling, you're having trouble breathing, please come to the emergency room. If you fall, hit your knee, you can walk, you're okay, you think you can do it this afternoon, go to urgent care. If you fall, you walk, you hit your knee, you can't move, by all means, come visit us.
Right.
There's a subtle difference there. And to go back, that chest pain, the shortness of breath, or if something's not moving, by all means, please come see us sooner.
In those situations, if you wait, you compound things.
For sure, you can get sicker, and time is brain, time is heart, so come see us sooner rather than later.
So in terms of just this, the medical director of an emergency department, you're not just there providing direct care, you're also managing a staff.
Sure, we have a tremendous staff of physicians, nurses, advanced practice clinicians, NPs and PAs. The staff that I have, we have working anywhere between 2 and 6 physicians and staff at any one time who are there waiting to see you. And we work to make sure that they are there and willing and ready to give the care that's empathic, that's top-notch, that is evidence-based to you at all times. So that's what we're working with this morning, making sure my physicians are giving you contemporary care that is beyond what you would get elsewhere.
And you mentioned NPs, nurse practitioners, PAs, physician's assistant. Maybe you could kind of distinguish what those do, what those each of them do.
Sure, they are healthcare professionals. They are there to help us kind of direct and guide the care where a physician can't get to that patient as soon as possible, or they're doing something else. They are empathic. They are very smart. They are helping us do the care that, like I said, we don't have the resources at that moment to deliver it. So they're still delivering the same excellent care. They're just delivering it to different people, and they're there to help us ensure we're getting the timely care. And that's actually part of our town, our city of Worcester, right? We have Mass College of Pharmacy and Health Sciences. We have Assumption. We have great learning programs for our people of our community, and they're coming through our hospital. We're teaching them, we're training them, and then we're bringing them onto our staff and our community to kind of help support our community.
Right. Meds and eds are a big part of it, that pipeline. But you alluded to kind of COVID and kind of coming out of that. I mean, as years have passed now, several years have passed, what trends do you see in terms of care and then even the workforce?
We see a lot of things have changed. Nothing is the same, right? The workforce has changed. There has been consolidation. There has been changes in your primary care office. Your primary care doctor may no longer be that country doc sitting with a shingle in his office anymore. They're affiliated with a bigger institution, a different company, or they have gone elsewhere. So getting access to primary care is really hard, and that's hard for our community to navigate. Sometimes it's hard for me to navigate and help find you a primary care, but we still think that's very important. Our nurses, during the pandemic, a lot of people decided this wasn't worth it for them. So we had a lot of people retire. You're going to see a lot of new and young faces, which is exhilarating. I love that my staff is younger. I love that there's new faces, there's new energy. We work with them. We try to encourage them and bring them up, teach them what might have been lost during the pandemic. And we've also noticed that we've had a cycle with COVID that it's come and gone, but it's still out there. People are still getting sick, right? We have access to healthcare, but blood pressure, general illnesses are still a problem out there, and people are still coming to us with COVID 5, 6, 7 years later.
Right. So we're entering the fall season, a little chilly in the morning now, and then winter, knock on wood, not too soon, but we'll have kind of snow, ice, and things coming. Common injuries you start to see in the fall and winter, and what can maybe people do to stay ahead of it and prevent them?
I appreciate it. This is a great time for me to give my seasonal reminders to everyone. People are going to be out in the fall. When you're carving those pumpkins, please don't carve your hands instead of the pumpkins. If we're carving something, use a safety knife, use it away from your body. Please don't inadvertently hurt yourself while you're doing that. Pumpkin injuries are not uncommon. Turkey carving injuries are not uncommon too. Everybody pulls out their turkey carving set for the first time in the year in November. That's going to be coming soon. Also, when you're out and about for Halloween with your kids, you're wearing a bulky costume. It's at night. It's dark. You're not seeing where you're walking. You're going to trip and hurt yourself. Use common sense for Halloween. Bring that flashlight. Watch where you're walking, and make sure to keep you and your family safe.
Got it. Doc, anything else? Website? Anything where people can go?
Look at the Saint Vincent's Hospital. If you go to stvincenthospital, I think .com is our website. And if you're seeking care, by all means, we have ways to engage you in our healthcare community. We were just talking with our cardiologist this morning. We have a great bunch of them who are there and willing to take care of you. Our ER is there 24/7, 365, and we can help engage you in our community of caring if you join us.
Great. Well, Dr. Adam Darnobid, who's the medical director, big job at Saint Vincent Hospital in the emergency department. Great to have you with us.
Great, thanks. Great to be here.
Keep up the great work. Thanks for being with us on this edition of Chamber Exchange, the TV show, and thank our sponsors, Bank Hometown at Saint Vincent Hospital.